Hello and welcome to the CNBC TV 18 special. I'm Shireen Bhan. Over the last 24 hours, there's been a plethora of meetings that have taken place to assess the COVID risk that India faces. But here's the update on our COVID trajectory. Active cases have declined for the fourth day in a row and stand at a little above 3,300 as of early this morning. The overall change in COVID cases in India over the last 24 hours stands at 163. The recovery rate is still above 98%. Vaccination rates have also risen steadily in the last 4 days. Over 87,700 people have been inoculated in the last 24 hours alone. As I mentioned, Prime Minister Modi chaired a high-level meeting to assess the COVID situation yesterday. We also learned from government sources that hospitals have been asked to organize mock drills to cover all aspects of treatment to ensure readiness in case India does see a rise in COVID cases. The government, of course, has reiterated that there is no reason to panic yet. It's also said it is keeping a close eye on the situation in China. Meanwhile, the Civil Aviation Ministry has plans to start random testing of international passengers who will arrive in India starting the 24th of December. 2% of arrivals will undergo testing. Now, to discuss the COVID situation in India and the threat that we likely face from the rise in cases in China, we're joined by Dr. Gagandeep Kang, Professor of Microbiology at the Christian Medical College, Vellore. Dr. Kang, always a pleasure. Many thanks for joining us here on CNBC TV 18. I know we had you here just 24 hours ago, but we're bringing you back because we're now dealing again with the virus of misinformation. There are WhatsApp forwards doing the rounds on how virulent this new strain is. It's deadlier than Delta. It's far worse than Omicron, and all kinds of symptoms being ascribed to it. So, which is why we want to get you back to clear the air. Now, let's understand the threat perception, Dr. Kang, at this point in time. Yes, China is seeing a rise in cases, but China has also been locked up for a large part of the last 3 years. How concerned should we be here in India? As I pointed out, in the last 24 hours, 163 COVID cases being added to the total tally were in fact declining for the last 4 days. So vigilant, yes. Alert, yes. But panic, no?
Well, obviously panic, no. The situation is not good for China, and that is something that was predicted when the country made the decision to end zero COVID. You may remember that New Zealand did exactly the same thing, locked up for a really long time, but then opened up when the bulk of its population was well vaccinated and dealt with the cases that happened from then on. In China, we are talking about a much, much, much larger population. We're talking about a population that has received 2 doses of vaccine some time ago and has not really experienced the virus for the last 3 years. That makes them particularly vulnerable when things open up. So it is not a good time for China. There is a lot that needs to be done for them to mitigate what is happening in their country. But India is not in the same situation at all. We have lived through 3 years of the pandemic. We have experience of handling the pandemic. We have a well-vaccinated population, and we also have a well-infected population. If we look at the rates of infection in our population, that is close to 90%. The adult population, the vaccination rate is above 90%. So overall, we have pretty good hybrid immunity in our population, and that reflects in the low number of cases that we have consistently seen over the past several months. Nothing has changed in the last week or the last month. We do not have any new variants in India. The variants that are circulating now in India are also being seen in many other parts of the world. There is nothing that has emerged that has more severe disease. Delta is the worst we've seen. We lived through Delta. What we are dealing with now is subvariants of Omicron.
Thank you for once again clarifying that, because again, as I pointed out, there are so many WhatsApp messages doing the rounds on XBB and BF7 and how they're much more virulent than the original Omicron strain. And that's what I want you to address. Is there any evidence to suggest that these variants are in fact worse than the original Omicron? And as you also pointed out, we have seen these variants in India over the last several months now. This is not new to India, and we haven't seen any uptick or surge in infections. So what does that tell us?
Well, these are subvariants of Omicron, and you can only be a successful subvariant of Omicron if you are able to escape the immune response and infect people. So in that sense, these are reasonably successful variants, but they are also variants that are in our vaccinated and infected population, not causing severe disease at all. The worry for China is that China has not seen infections before. So therefore, for them, their population is at greater risk of having severe disease because they don't have the hybrid immunity that is in India. XBB as well as BF7 are subvariants of Omicron, which everybody who has experienced Omicron knows is can be symptomatic, but is not nearly as bad as the severity that we had with Delta. So I think in India, we need to have an understanding of the local context. And right now, in the local context, there is absolutely no cause for alarm.
Absolutely. And as Dr. Kang is pointing out, and that is what we're underlining here, that China, because of its zero COVID policy and because it has stayed shut for a large part of the last 3 years, they don't have what India has, which is high infection rate as well as high vaccination rate. So combine that, we are dealing with hybrid immunity, as Dr. Kang has explained, which China has not been able to do. Now, Dr. Kang, I want to understand from you, because once again, there is talk from the government on go out there and get a booster dose. Now, if you've already been vaccinated, either have got the booster dose or are now looking at the booster dose, is this a good time, if you haven't had the booster dose, to go out there and get one? Does it make sense to boost yourself at this point in time?
If you are an older individual or you have comorbidities, but age is really your greatest risk factor, it makes sense to get another booster dose. In India, there is zero, and I repeat, zero evidence that vaccines are failing in any way. Now, is this a lack of data, or is this that our vaccines are performing beautifully? I think it's more likely to be the former, but the fact remains that in India, there is no evidence of vaccine failure. So if we look at who needs to get vaccinated, it's really the idea of abundant caution to make sure that people who are potentially vulnerable because of their age or their comorbidities, those are the groups that can go ahead and get a booster dose, because there is some potential for benefit, likely to be small, but at least some potential for benefit, and very little risk of harm. So my advice would be, if you're older, get a booster dose. If you're generally young and healthy, the value of a booster is less clear to me.
Yes, so that if you have comorbidities and you're a senior citizen, then it might make sense for you to go out there and get a booster dose, so should you wish to. But if you are relatively in good health and in the younger demographic, well, then it really is a personal choice that you need to make. But Dr. Kang, I also want to understand from you what we've seen come in from the government today, and that is the clearance for Bharat Biotech's intranasal vaccine. Now, we're not in short supply as far as vaccines are concerned. Both Serum and Bharat Biotech are equipped to roll out vaccines should it be necessary. But as you already pointed out, 90% of the population, the adult population, has already received both doses of the vaccine, and in many cases the booster dose as well. Now, what do you make of this intranasal vaccine, and do you believe that it is a good idea to boost with the intranasal vaccine, or for people who are saying, okay, it's not a jab, it's an intranasal vaccine, should I just go and get myself one?
Well, the vaccine is a vaccine that has been licensed by the Drug Controller of India. It's been licensed, in my understanding, on the basis of immunogenicity studies, essentially studies showing if you take the vaccine, you make some antibodies. But you take any vaccine that is licensed, you will get antibodies. Will those antibodies protect you or not? That is something that can be determined only from clinical efficacy studies. As far as I am aware, there are no clinical efficacy studies with either the Chinese nasal vaccine or the Indian nasal vaccine. So if you would like to take this vaccine, I would say it would be fine to go ahead. But in terms of the value that it might have, that is not clear to me at this time. And I certainly hope that if the government recommends this vaccine, they also put in place measures to gather data on clinical effectiveness of this vaccine, its actual performance in prevention of disease. Now, I will say that, when you give a vaccine when there isn't very much disease around, it becomes very difficult to show that the vaccine is working. Right. So this is a complicated situation, and I hope that the government has a plan to deal with it.
Well, we are still awaiting details on what that plan is likely to be, but what we're given to understand is that the rollout is expected to take place in private hospitals. But our feedback after speaking with private hospitals is that they have not placed orders yet for either additional batches of Covishield or Covaxin, or in fact for the new nasal vaccine from Bharat Biotech. Let's now address the issue of masking, Dr. Kang. And, advisories have come in from the IMA, from the government, etc., that, mask up, and it is prudent to mask up at this point in time. What do you suggest?
I think if you are a vulnerable individual who needs to protect yourself against infections in general, respiratory infections specifically, and SARS-CoV-2 even more specifically within that group of respiratory infections, then for you to be masked is a good thing at all times. But if you're vulnerable, protecting yourself from infection through masking, through maintaining hand hygiene, all of these are good practices. If you are not a clinically vulnerable individual, and you happen to be infected, it could be influenza, it could be SARS-CoV-2, then it is respectful of your community that you don't go out and spread your infection. And if you don't have a choice and you need to go out for any reason, then please do mask up, because you don't want to spread the infection any more than you need to. In other situations, it's not so clear that masking is something that can be maintained or has value over time. So obviously, if there is a lot of infection in the community, we are back in the situation that we were in, let's say, April or May of last year, then it would make sense to mask when there is a lot of active infection around you, because you want to protect yourself as much as possible. You might be asymptomatically infected when there is generally high infection in the community, so you don't want to pass it on. But when there is a low level of infection in the community, right, you're going to be wearing a mask all of the time. You see what kinds of masks people wear. Cloth masks have practically no value at all. And lots of people are now reusing their masks. Some of the masks I look at, I don't think have been changed in a month. So I don't think masking really has value for people when there isn't a lot of disease around. Masking has more value when you are in an uncrowded situation, Like, for example, if you're outdoors somewhere, it doesn't really make sense. If you're in a well ventilated setting, masking is unlikely to be useful. If you are in a very crowded setting and you think you would like to protect yourself,
Yeah.
sure, go ahead, mask up. It will give you some level of protection.
Right.
But in general, if there isn't disease in the community, then what are you protecting yourself against?
Dr. Kang, finally, before I let you go, testing. Now, random sampling of 2% tests being done at airports starting the 24th. Of course, surveillance on at this point in time, according to state governments. What is the effectiveness of the testing strategy, of the strategy that's now being taken forward, and what do you believe we should be mindful of?
So if you test, let's say, 1 in 10 or 1 in 100 people who come in from somewhere, you're hoping that infection among them is at a high enough level that you will detect it. You are also doing this in full knowledge that if a virus can infect people asymptomatically by testing a random sample of people, you are not going to be able to pick up every infection. You are sampling. And in that sample, you need to be lucky, or the infection needs to be happening at a high level among incoming travelers for you to be able to detect anything. But if an infection is detected, then it is a good idea to sequence to figure out what is going on.
Right.
Now, usually sampling incoming travelers should be done for a reason, with an understanding of the action that will be taken once that sample is found to be positive. And to have clarity on that is going to be really important for the government. There's no problem with testing more or sampling more, but you do need to know what you will do with the data when you get it.
Yes, so at this point in time, India is in a relatively good spot because of our hybrid immunity, on account of the high infection rates that we've seen over the last 3 waves, as well as the high vaccination rate. Be alert, be vigilant, but please do not spread misinformation. The variants that China is dealing with are variants that India already has in play and has had in play for several months now. So, no talk about lockdowns or restrictions at this point in time is warranted in any form or fashion. Dr. Kang, it's always a pleasure. Appreciate you joining us here on CNBC TV 18 to help clear the air on many of these issues that are back again, and sort of lots of rumor mongering as well. So it's good to have you back to speak with us. Always a pleasure. Thanks very much for your time. That's it then on this edition of CNBC TV 18 special. We'll take a break. There's a lot more coming up. Don't go anywhere. We're back in a minute with more.
Powered by